this week, and today we have seen the schools reopening in spite of continuing high residual rates of infection in the community and the emergence of new strains that the government keeps telling us are potentially more dangerous. We're going to be discussing that whole situation and the impact of it on the NHS. And I'm delighted this week to have Adam Hamdi, one of our pandemic experts, Karen Bales from the education sector, and Bonnie Craven, who is an NHS activist and socialist teleregular. Welcome, everybody. Thanks for joining us this week. Schools have, well, I won't say returned because they've been going at pretty high levels of occupancy for throughout the supposed lockdown, but they've fully reopened today. Adam, tell us a little bit how you see the government's decision on that and what the likely impacts are going to be.
I mean, the Prime Minister has talked about being cautious and taking things, with a degree of safety in mind. And at the same time, we keep hearing about the Big Bang. And sending millions of children back to school all on the same day is certainly not a cautious approach. If you look at other countries, if you look at Scotland, for example, they have got a staged approach to school reopening. We've got masks in secondary schools and classrooms now, but primary schools, there are no masks. If you compare our schools to what the CDC have recommended for American schools, the CDC now says that if you have more than 100 cases per 100,000 people, your schools should be closing and moving to online only. We have around, in England, around 86 per 100,000. So around the time that American schools will be thinking about moving to online, we're opening up. And we're doing it without any of the safety measures that the US Center for Disease Control recommends for American schools. Increased ventilation, distancing, masks for everyone over the age of 2. HEPA filtration, so air purifiers that pull the virus out of the air, and many other measures that they recommend for schools to open safely. We don't have many of those in place in British schools. So I think there's arguments over how much schools contribute to transmission. Even if you're somebody who doesn't think that they contribute a lot, it's clear that the sheer number, the volume of people that we're sending back into close contact is going to have an impact on infection rates. And what we haven't taken account of is that schools shut for the Christmas break round about the time that the B117 new variant started to sweep across the country. It is now the dominant strain in the UK. And so what we're going to see is this variant that we have been informed by SAGE is roughly between 30 and 70% more infectious and 30 and 70% more lethal. We're now going to see this move through the schools. And a lot of other countries are reporting that this variant seems to be having more of an impact on children. Not a severe impact, but it's causing more infection and more obvious illness in children. So, essentially what we're seeing unfold here is another mass experiment. And that's what the government's doing. So I think this is ill-advised. And it's short-term thinking. They haven't put in place any of the measures that are going to make this sustainable. And they are banking absolutely everything on the vaccines.
And you were saying before that the UK is almost unique now in the world in terms of its position on schools and the way that it's handling the school openings, etc. So tell us a little bit more about that.
Yeah, I mean, obviously you have now, until Trump lost the election, America was kind of alongside us with a quite a lax approach. The CDC to an extent was being censored in terms of what it said. Since the Biden administration has come in, the CDC is definitely now following the science and has made a raft of recommendations in terms of ventilation, in terms of masking, all that kind of thing. But even if you look across at Europe, French schools, Spanish schools, Italian schools, from the ages of 6 upwards, so primary schools, they're masking, reduced class sizes in Denmark. a combination of online and in-school learning. So there's a rota system. I mean, all sorts of things in other countries. And really now we're alongside Sweden, essentially. And even in Sweden, they put in measures to close older high schools, for a period of time just before Christmas. So we are kind of on our own in terms of our lack of measures in schools. And the one thing that I would say that seems to have more of an impact is ventilation and filtration. Ventilation, making sure there's lots of fresh air coming into classrooms, and filtration, pulling particles out of the air. Those seem to be the two big things. So even if you're going to make masks into a political issue and a sign of freedom or whatever, every single parent should be supporting better ventilation and filtration in classrooms. They're non-invasive measures. They just take a bit of investment, and they significantly reduce risk. And the government wants us to believe that we can cope with a level of transmission. And if the R goes up and there's increased transmission in the community, that isn't going to be a problem. But actually, we don't know enough about long COVID. We don't know enough about what the long-term impacts are on people who catch this virus, because there are a number of people now who, according to the ONS, it's about 10% of the adult population who catch the virus go on to exhibit long-term symptoms. And there are people now who've been ill for a year. We don't understand what's causing this and why, and we should be trying to seek to reduce transmission to the minimum. So even if you don't feel that there's risk in terms of mortality and deaths, there's other things to think about. And of course, the big thing in the last few weeks has been variants. The more transmission you have, the more chances you have of mutations occurring and variants coming along that are going to prove problematic for us further down the line. So it's really short-term thinking all around to allow transmission to be taking place in schools or anywhere else.
Karen, you were mentioning before the show that the government has been showing some nice, reassuring looking classroom scenes, etc., that don't bear a great deal of resemblance to what's going on in reality. Tell us some more about that, please.
Well, yeah, the whole back to work campaign thing has been a source of frustration for the last week or so. Listening to television adverts saying that teachers will be protected because of the improved ventilation, and there's everybody sitting back going, "What ventilation is this?" Chris Whitty in one of the in an interview also said that we would have masks in secondary, we would have LFTs. And there's a whole range of other additional measures that will keep us safer than December. I was like, I'd like to hear him define what those whole other measures are, because as far as I'm concerned, I thought I'd read all the DfE guidance and didn't see any extra measures. So maybe my copy was missing some pages. The reality is that we've got 30 kids in classrooms today. Some will be wearing masks, some won't be wearing masks. And people will be asked to keep their windows open, and that's all we've got. Plus the LFTs, which is a whole nother topic as well, isn't it? Of how effective they're going to be. But what we're also going to see as well, and it's only anecdotal at the moment, is it's going to differ between regions as well. So what I'm getting is that in my area, we've got very high compliance. I'm in the home counties, but talking to some people in the most deprived areas, their consent letters to use LFTs and more kickback on masks as well. Anecdotally, we're seeing more of that. So you're going to have less children being tested with their LFTs, which even if they are only not as reliable as we'd like, at least they provide some kind of screen. They're going to have less of that. And the main reason we can assume is because the parents can't afford to isolate, so they can't afford to test their children. Yes. And we're going back to that whole story again, aren't we? But yeah, I have seen, I spoke to one school where they've only got about 40% consent at the moment, which is compared to mine, which is about 80%. So that's a huge differential.
It is. When you say LFTs, that's the lateral flow test, if anybody wasn't aware what that's referring to. But Bonnie, those tests have been shown to not be that reliable in terms of, well, not catching every positive, but also reporting false positives on people. Tell us a little bit what you've heard about that.
In the mass testing at Liverpool that they trialled a few months back, the trial was cancelled because they realised that they were only picking up 40% of the actual COVID infections on the people that were testing. And there's about a 1%, from what I've read, about a 1% false positive measurement as well. And guess which error the government are pushing is the problem. It's they're saying, oh, but 1%, they're saying people have COVID when they don't have COVID. So I'm more concerned that there's going to be a false sense of security for teaching and school staff and for parents. If parents are getting negative lateral flow test results for their children, or at least even saying that they have, sending them to school and potentially exposing other children and school staff to the same virus. And I'm also concerned because we're only beginning to learn, Adam picked up on the long COVID and so on, we're only just beginning to learn what this virus does to children. And there was an article in Forbes magazine last week that came out talking about the risk of long-term harm from various viruses. Obviously, we know if you have chickenpox as a child, you're going to end up, or you could end up with shingles later on. And I'll just read from the article. It says, a study done to assess the long-term effects of SARS-CoV-1 shows that it can cause persistent and significant impairment of exercise capacity and health status in survivors of SARS over 24 months. Now, our children's bodies are growing and developing while they're of school age. Is this really something we can afford to gamble with, even if they survive the virus, and even if all of their families survive the virus? What are we setting up in the long term for these kids?
And your kids haven't gone back to school today, is that right?
No, they I was concerned that the numbers would go up in September, which they did. I kept them off from September. I faced threats of prosecution, so I was forced into a position of having to deregister my children in a London school, which, you know, the places are very highly prized, but I had to deregister all of my school age children from school in order to protect myself and my family from the virus. And now I'm looking on lots of the parent social media groups and so on, and everyone's kind of agonizing whether or not they should have sent their children to school today. But at least I'm no longer concerned about that. I'm just making sure that they get their education at home through online resources and textbooks and so on, alongside doing my day job. It's not ideal, but at least we're safe.
Well, quite. I think there's been a major problem in terms of the communication as to what's going on as well, from the government, but repeated parrot fashion by the media by and large, which is still, in most cases, when you hear on the news about the number of single doses that they've been given to people, the media will repeat that as people who've been vaccinated. And, the number of people receiving any kind of dose seems to have slowed down recently. But the numbers in terms of people who've had 2 doses, even assuming they've had 2 doses of the same vaccine, which I'm not sure is a given, is, I think, hasn't quite gone over 1 million, or maybe just gone over 1 million now. And, one of the things that gave me cause for concern last week was that the SAGE scientists were making very clear in the comments that they were making that, they see the reopening of things now as being by and large a threat to the effectiveness of the vaccine rollout. So we're seeing, the vaccine program put at risk by the decision to reopen now. And, the flip side of that coin is that it's been the lockdown which has brought down the number of cases, not the number of people receiving a single vaccine dose so far, which is the spin that the government and the media have been feeding us. Adam, let me bring you back in on that first, but I want everybody to feel free to jump in at any point, and we'll get a bit of a conversation going on this, because the damage control and the public relations side of this thing is not necessarily conducive to people's health and to a proper sense of what's going on in the country at the moment. So, Adam?
I think if you look at how we're perceived in other parts of the world, it's really interesting. So if you listen to some of the media coverage in Australia, for example, they talk about us being in an absolute emergency and having to do things that would never normally be considered. And the government has gone all in on its vaccine strategy, and that's because the 2011 pandemic influenza plan, which is what they've been following since the beginning of this, has vaccines as the exit. That is our way out. The the issue with that is that when you have a pandemic strain of influenza, you will develop lifelong or close to lifelong immunity from it if you get infected. So basically your susceptible population is shrinking at all times, because people who get infected will then go into the non-susceptible category. Coronaviruses are very different. And until this came along, we didn't really have a great understanding of why, whether it was waning immunity or whether it was, viral evolution. But they reinfect us on a fairly frequent basis. And so what we're seeing now with the new variants emerging is, South Africa in January reported 4,000 reinfections with the new variant. And we're seeing reinfections happening now across the world. Brazil, in particular, they're reporting a lot of reinfections with the P1 variant. Some scientists in the West are very skeptical of this. So this is a very different virus to influenza, and it kind of cuts to the heart of why the government's response is problematic. If you were trying to neutralize this virus using vaccines, you would keep cases as low as possible. You would do what New Zealand and China have done and try and vaccinate people against a backdrop of very, very few cases, because then you're giving as little as possible opportunity for mutations to occur, and you're largely combating the original strain. Because if you don't have mutations, you've got a certain efficacy from your vaccines, and it's going to put the fire out. Doing what we're doing, where we know now that we have 8 variants of concern or variants under investigation circulating in the UK, it's not the most responsible way to be trying to bring us out of the pandemic. Now, it should be stressed that for most of the variants, there is a degree of efficacy being shown by the vaccines, but we don't quite know what that's going to translate to in the real world. This is a big experiment. The single dosing strategy was another sort of desperate move because of the crisis that we're in. They're trying to put the fire out. And so at the heart of this is, the government's assumption right from the beginning that interventions, and Chris Whitty's on record saying this at the House of Commons in Health Select Committee, 4th of March, I think it was last year, that interventions should come as late as possible and they should be eased as soon as possible in order to protect the economy. And if you read the 2011 influenza pandemic plan, the number one priority above public health is economic stability and economic productivity. And that's been the problem right from the outset. They failed to realize that in a pandemic, health is the economy. So I'm really pleased that there are these effective vaccines being rolled out. I'm concerned that we are undermining them in quite a serious way with how we're behaving, essentially.
We saw Boris Johnson say quite recently that the UK will not adopt a zero COVID strategy. So he has no interest or intention in trying to eradicate this virus, and every intention of letting it rumble on. By contrast, we've looked at somewhere like New Zealand, which I think was last week, went into another full lockdown because they'd had half a dozen cases emerge. Had a few people moaning about it, but they get back on top of that very quickly. And I think they're still within the period that we've seen, officially admitted 125,000 cases, but much more than that in reality. New Zealand has had 25. I think that's still the latest number. And their economy has seen negligible damage compared to what we've seen. So I think you're absolutely right. Bonnie, what are you seeing in terms of the impact on that in your local community?
Well, all of the usual measures for the performance of a government are based on health and wealth, right? So the standard measures we might be looking at to consider the effectiveness of the current government, and for what it's worth, opposition, would be how people are living, if they're living good, healthy lives, and how well the economy is performing. And on both of those key measures, our government have got it so badly wrong. We've had over 120,000 people, even under their own restrictive measures, die. That's a family that have lost someone that they love every time. And it's touching more and more people. In my local community, I can think of 4 current cases of COVID that I know of in my street and the next one. And I don't think that's particularly uncommon. And if you look at the economy is totally tanked. But the billionaires have never had it so good. So the stock market is flying really high, and the average worker is seeing pay cuts, job insecurity, reduction in available hours, attacks on public sector workers like nurses and so on, the prospect of increased tax because of where people fall on the tax bands because they've been frozen. Should you manage to negotiate even a slight pay rise, more is going to be taken from you in tax than you're going to gain. We've got recruitment and retention issues in all of our public services when we need them more than ever before, and we're just heading to a total catastrophe. You know, this is the sick, the disabled, the expensive people are being, it looks like, being deliberately discounted, and it's, you know, from the outset it's been, the narrative has been, oh, but they had underlying conditions anyways, almost like, well, they didn't matter then. But they did matter. Until they caught this virus, they were living good, productive lives, contributing to society or the economy or both, raising families, caring for people, human lives, basically. And they're just being discounted. And, you know, and I think if we started looking at the real number of people that died of coronavirus or as a result of coronavirus, it's going to be considerably higher than any number the government are going to be prepared to admit to.
Yes, I mean, I think that, you know, the fact on the numbers, the admitted numbers are 125,000, give or take. But those are people who died within 28 days of a positive diagnosis or positive test for coronavirus. If you get discharged from hospital and die after the 28 days, you know, or you die in hospital after the 28 days, then you don't count towards those statistics. And there was data that came out, I think 10 days ago now, that said of the people who've been hospitalized for coronavirus and then get discharged having become apparently well, 1 in 10 are dying within 12 months. So, you know, think how many people have been in hospital but haven't counted in those death statistics. It's quite a staggering number, probably, to add on top of that, even allowing for the, you know, the previous kind of tweaks that the government's made for it to try and make themselves look less guilty. Karen, what's the morale like in schools among teachers with this whole fiasco being imposed on them again?
I think there is quite a lot of stoicism at the moment. I think there are a lot of people. Of course, there's general concern for the students. Everybody is worried about students, and there is a general sense of fatigue within a lot of people. Remote learning is exhausting, and it's not as rewarding a job as when you're in front of the kids and you're working. And I think that there is general attrition on the general public as well. It almost makes me wonder sometimes when the government set out the guidelines for remote learning that they didn't do last time. They were very specific on the amount or quantity of work we were going to be given, the amount of screen time. For secondary, it's not so bad, but when you're looking at like 7-year-olds being expected to do 4 hours of on screen plus some homework as well in a lot of schools' cases, it almost felt like let's bury the children in the work, let's bury the parents in work, and they'll want to get back to school. And because the infection numbers are on the slide, you've got the vaccination there. A lot of people are thinking, we know this isn't like, we probably shouldn't be going back in here, but we've got 3 weeks to Easter, and then we've got another 2 weeks. And it's almost like a lot of people are just going, let's just see this through and see where we go, which isn't really where we want to be. You've always got to take into account that there's quite teachers, unlike what media like to say, which is teachers are a homogenous group. If you're looking at all of your support staff and all your teacher staff, there are quite a wide variety of groups. So there's a lot of different views, and you are seeing that difference between also individual risks. So where you've got those members of staff who've literally being vaccinated this week, they're just thinking, well, why can't I just wait till Easter? Then at least I've got the first jab in me. And you've got other people who are teaching is quite a young profession these days because of the sheer attrition of older experienced staff that we've had. 8.5% of teachers left in 2019 for reasons other than retirement. That's our turnover at the moment as a profession. So because you do have a lot of younger people who are less concerned for their personal risk as well. and they're going in. But then you've got other young people who are really worried about long COVID, particularly if you're in a school where you've already got a couple of members of staff who are really struggling as well. So that's why a lot of our schools, we're already stretched because we've still got shielding colleagues that are off. We've got and then we've got long COVID cases as well. In my school, we're having to cover already before we start having our isolation and stuff. So I can't see how we're going to stay fully open. We'll probably have a week of reasonable figures. We'll start to see a slight uptick, but by the final week before Easter, I'm going to expect to see a lot of year groups off, a lot of schools struggling, and there'll be some closures even before Easter.
Yes, and you mentioned the sliding infection numbers at the moment, but I think there's a large pinch of salt needs to be taken with those, because I think the government has created so many perverse incentives in terms of the whole thing that there are so many people who, if they think they might be infected, simply can't afford to take a test, can't afford to install the app on their phones, even if they trusted the government to not to abuse the data, because if they got told to self-isolate, the amount of help they'll get from the government is not going to see them through the amount of time that they're going to be required to isolate. If they turn out to be infected, it's going to be longer. If their family catches it again, etc., etc. I believe there'll be a large pool of people who may be infected and are terrified to actually get caught being infected, because it's going to put them into severe financial hardship. I mean, Adam, what effect is that going to have on the reservoir of infection and the speed that the virus might bounce back now that everything's starting to be reopened?
I think there's so many variables now, it's getting much more complicated to forecast. However, we are now dealing, as I said earlier, with the B117 variant. So it is more infectious, we know that. It seems to transmit better in children. We don't know whether that's because it transmits better through everybody, or whether that's because children are particularly susceptible to this variant. But it does have that increased transmissibility. Masks in secondary schools will take some of the heat out of transmission, hopefully. People, I think, who were complacent after the first wave and said there wouldn't be a second wave will have had the wind knocked out of them a bit by what's happened over winter. So hopefully people will be a bit more careful. But I would expect to see infection rates rise, fairly quickly, because we're going into this now, the schools with roughly 6,000 cases per day officially reported. And I think in September we had something around 1,200 a day. And then, no, actually, I think September was about 400 or 500 a day, and then it grew pretty quickly from that. We're way above previous reopenings, so we're starting from a much higher level. It's worth also pointing out that the government's using lateral flow tests much more as part of the national testing program. So I think last time I checked, and don't hold me to this, it was around 2/3 of tests were being done with LFTs as opposed to PCRs. So there may be issues there that we haven't quite seen work through in terms of the accuracy of the numbers. I want to come back to something that Bonnie said earlier about SARS-CoV-1, the original SARS virus from 2003, 2004, and the impacts that had on people. A lot of people have been talking about SARS-CoV-2, the virus that causes COVID, like it's the flu, like it's one of the endemic coronaviruses that circulate. But it's actually very different. Structurally, from a molecular perspective, it has a number of features that sort of take it out of the ordinary. And it's also throwing up clinical results that are abnormal. So one of the things that I know a number of scientists are concerned about is that you have this super antigen in SARS-CoV-2, which is something that you normally see in serious bacterial infections. And it's a small protein sequence that hyperstimulates the immune system. And in particular, a number of researchers are worried about what it's going to do to long-term neurological health. So we know that the virus can infiltrate the brain. We've seen some of the impacts that it has in terms of impairment, in terms of, when people have been autopsied looking at actual physical damage to the brain. So there are some concerns about long term. What is this going to mean? We've also seen that it's throwing things up that we've never seen before. Some researchers recently looking at again looking at the brain found that there were specialist cells that are normally only seen in the brain, in the bone marrow, had been found in people's brains. And the way to think of them when they're in the brain is it's a huge clot. And they've never seen this before. These are things that have never been encountered before. So there are presentations, there are things happening with this virus that haven't been seen before. And it's not to be alarmist and it's not to be scary, but it's also to say, don't minimize this thing. We still don't understand it. And just one final thing is, it's moving, it's evolving. If you talk to evolutionary virologists, people who study the evolution of viruses, they're concerned that this is becoming better at infecting us. And with each evolution, it seems to be becoming more virulent. Now that could change, it could go in a different direction, but so far the direction of travel has been to become better at binding to our ACE2 receptor, which is the route that it infects us, and as a part of that becoming more virulent. So the D614G variant that came out early last year was slightly more infectious than the original strain. And then B117 is another step up. If you believe the early reports that are coming out, the early research that's coming out around the P1 variant, they're saying that it's twice as infectious and twice as lethal as the original. So again, a little bit of humility and a little bit of caution would be advised, because we don't fully understand where this is going. We don't fully understand what the end point is for this virus. And we should be doing everything we can to keep cases as low as possible. And what's frustrating about it is it doesn't mean, Karan, we were talking about us for them. They try and paint people as being in the shut everything down or open everything up, two sides of what it means is taking simple steps. Talked earlier about ventilation and filtration, using masks where possible. There are things we can do, practical things right now that would help keep cases down, and we're just not doing them.
Yes. Is the government gambling on a warm weather effect? Is that essentially what they're doing now?
Yeah, I have no doubt that that's part of the equation. Is and that's going to have an impact. People are going to be outside more, and that does help. That will reduce, reduce the transmission risk. So I am expecting they may get away with this by the skin of their teeth, but even their own models at the low end are saying we should expect a further 30,000 deaths over the summer months. That's the government's own modeling, and that's the low estimate.
Yes.
And so far, reality has always tended to or exceeded their high estimates.
They started out saying 20,000 would be a good result, didn't they? So it's gone 6 times higher than that in the space of a year. 6 times 30,000 is yet more avoidable deaths.
Yeah, I mean, on that, the upper estimate is 152,000. That's their upper. That's kind of like the worst case scenario that they're modelling for, and they've accepted that.
I think we're well beyond that already, but in real terms. But you mentioned the P1 virus. That's the so-called Brazilian variant of the virus, and we saw recently a big performance going on, heavily covered by the media, in which the government was pulling out all the stops to track down one person who had been tested and proved positive with this version, but they didn't know where they were, so they were trying to hunt them down and put a lot of effort and resource and time into that. And yet essentially what Johnson and co are doing by allowing the virus just to continue spreading and mutating as it goes is creating the conditions for homegrown new versions. Now it might be just the question that being the Conservatives, they think, oh, we don't want any of that foreign muck here, we're going to grow our own more deadly versions. But it does seem to be that there's a bit of a charade going on at the moment in terms of what they're trying to persuade us is happening and what they're really doing. Karam, have you seen any of this stuff going on?
But the government's marketing.
Yes.
Oh my! Well, I think that's the problem, isn't it? We've constantly had an approach of public relations, not public health. And that's the phrase I've always keep coming back to, and it's quite as we were saying, like we're an outlier. We've got less safety conditions than anywhere else, and I think the government are really worried about attendance this week. They're worried that a lot of parents aren't going to send their children in, because that's what has happened in the past as well. I think it was June, wasn't it? Attendance was lower than they originally expected in June. For those year groups, they eventually opened up after their U-turn. I think that's that principle, isn't it? The mandating, like in the guidance, it says if you have parents who are clinically vulnerable, reassure them that school will be safe. And I don't think any head teacher can guarantee that. And then after that, it says remind them that remind them that it's mandatory and that there is a sanction process. So it's like, whoa, like very like the carrot is imaginary, but there's a massive stick that they're willing to use. And you think, like most other countries have had like an option to put your children onto remote learning. Anybody that was feeling unsafe, generally because of a medical vulnerability, could choose to roll. Like in France, they opened up a register for 3 weeks. Who wants to do that? And then it makes the school safer as well. You get your pupils out, so we've got more space and more social distancing going on in the classroom as well. It just doesn't make sense. It's the same with this LFTs, isn't it? The amount of money they spent on LFTs, and you're like, we could have bought portable ventilation units to put in, and that would have actually, rather than worried about reducing the impression of how many infections that there are, they could have actually reduced transmission. Instead.
Well, if you're talking about buying ventilation units, you wonder how many units you could buy for £37 billion, which is what we find they're throwing into a test and trace system that has been a complete failure and is, I think identified something like 276 outbreaks or risks of outbreaks in the, in hospitality venues at the cost of, even if you discount everything else but restaurants and fast food, at the cost of around 131 million per identified hotspot, which is just insane. I mean, we could build, HS2 or the Channel Tunnel didn't cost a huge amounts more than those in relative terms. But Bonnie, are we being fed pandemic theatre? Is that what?
We really are. I mean, I've been watching the media push ramp up to have children return to school today. Now I feel removed from that because I've already made the decision to opt out of that, and I'm fortunate to be in a position to be able to do it. But I've seen, the pressures being cranked up on parents. It's bad for children's mental health to be at home. Go figure. It's bad for children to be around the families that love them, protect them, and do everything they can for them at a time of national crisis. Look, we're living through possibly the most stressful times since World War II. Effectively, there are dangers out there that are invisible, and people are being made ill and dying from those dangers. And a few months ago, I had an educational psychologist on my NHS show talking about children's mental health. And what she said is certainly reflective of my experience as a parent, and I'm a qualified teacher as well, so from my time in the classroom. Children need security and stability. Constant change in children's lives destabilizes them, and that impacts their ability to learn anything. So what we've got now is a situation all the way through the term from September to December. We had schools partially closed, reopened, closed, off, on, which obviously is really difficult for parents to manage as well, because they've got childcare responsibilities and jobs to hold down. If we had a situation that was stable, and as Karam said, if parents who were able to keep their children at home and wanted to do so were given that option, there'd be fewer children in school. It'd be easier to keep the infection rates down. That would be far preferable to forcing everyone in. I mean, the first day of this term, everyone was expected into school and parents were being threatened again. And yet, by the time those kids got home that day, schools were closed again. That is so bad for the psyche and the mental health of the children and the families that are affected. We shouldn't be looking at forcing kids back into school until we genuinely know it's safe. In any other circumstance, if a parent knowingly places their child in line of harm, they're culpable, right? They're responsible for that. Let parents exercise their own judgment on valid concerns over this crisis, and maybe we can see the back of it.
Yes, I mean, I think there's no question, because I've seen it in kids around here as well, that there's this fear factor among the kids because they know that the virus is there. They know they risk picking it up when they're at school. They're terrified they're going to be the ones who, take it home and kill granny or whatever, and then have that burden on them. That must be a massive psychological and emotional burden on kids. But I mean, the charade side of this.
Sorry, I was just going to say they're layering over the top of that this need to, in inverted commas, catch up. Catch up with what? We've never been here before. What do they need to catch up with? Is it not the case that survival skills, learning care and compassion for people, how to keep yourself safe, all of those things, are they not important life skills as well? Children
survival is the key thing.
Exactly. Kids can't help but learn stuff. They don't have to be sat in the, I'm saying this as a qualified teacher, but sat in the classroom with 29 or 30 of their peers and one adult at the front isn't the only model of education. It's the most time effective and efficient mode of education, but at the moment that's just not possible to happen safely.
Adam, you mentioned with regard to the charade that's going on at the moment, the P1 Brazilian version that we've just spent a large amount of time and money and media attention hunting down one person with. That's very close to our own borders and has easy access to this country.
Yeah, so it's pretty widespread in France. The P1 variant is pretty widespread in France. So is the South African B1351 variant. That's pretty widespread in France. Yeah, I mean, I think P1, off the top of my head, I think P1 is now in, last time I checked, 24 countries. It's been confirmed in. Obviously, it's probably in more because not many countries sequence to the standard required to detect these things. We're the leader in sort of sequencing viral samples in the world, us and Denmark. So yeah, I mean, it's in quite a few countries. It will come here eventually. I mean, you should assume that unless you have border controls like South Korea, like China, I mean, New Zealand's effectively closed, so it's not quite the same, but you can travel to South Korea and Taiwan, China. If you have infection controls like that, you can probably keep these things out. But if you have what we have, you're not going to be able to keep these things out. And coming back to what I was saying about, there's a direction of travel. This is still a moving target. The virus we have now is not going to be what we have in a year's time. There was a new variant reported on Thursday from the Philippines. And it looks like it's another variant that's going to cause concern. It has a number of changes on the amino acid changes in the sequence that look like they're going to be problematic. And so far they've reported 33 cases there. So, this is going to continue to be a problem. How much of a problem it is in terms of vaccine effectiveness and that sort of thing, we're only going to find out, in the next 12 months. We're only going to know through experience, which is not how it should be. We should be rolling out these vaccines against a backdrop of, minimal cases and not really stress testing them until much later in the process, until we have more data on how well they're performing. But the government's decided against that. That's not its policy. The other thing that I just want to come back to is, picking up on what Bonnie and Karam said, there's a definite change of tone, I feel, with this government, just as a parent and an observer, in how the education is being approached. This whole thing about, falling behind and catching up and all that sort of thing. And this idea of, mental health. And one of the things that really concerned me last week was seeing the speech that Gavin Williamson gave, where he said that children needed to be taught that success in life came from being well behaved, respecting the rules, and following discipline. And it was this speech that he gave all about how the government was going to enforce discipline in schools and back teachers up to take a much harder line with children. And, and I just read this speech and it was just, it sounded like something, and I'm not prone to melodrama, but it sounded like something coming out of the mouth of a fascist. It was awful, because actually what we should be trying to do is encourage creative thinking and creativity, and obviously you don't want disruptors in the classroom and people who are badly behaved, but you do want people who question and don't accept authority unanswered. That you should have to justify and be happy to be challenged as an educator. And more important than any of the things that the government's doing is the one thing that they could do is try and inspire a lifelong love of learning, because that's the best catch up you can have, is to continue learning as an adult, so that school isn't something that just has a cutoff, that you're encouraged to think about the world in a way that is exploratory, that you want to keep learning as you grow older. Then it doesn't matter whether you have a year off where you're having to deal with the stresses of a pandemic, because at some point in your life, if you're encouraged to embrace learning as a good in and of itself, you're going to catch that missed time up, if there's anything to catch up at all. Arguably, I think they're doing a great disservice, because obviously we have 3 children and I've seen what they've been doing in terms of online learning. It's been great. And so teachers have worked really hard to try and deliver the best kind of learning experience that they can, given the constraints. And it does a huge disservice to all the educators out there to say, oh, kids are really behind and they've fallen behind, they've got to do catch up, and we've got to shorten the holidays and increase the working day, the school day. It's very, very concerning, all of the rhetoric that's coming out of this government.
Yes, well, I mean, yeah, I think it's no surprise to most people that the current Conservative government probably isn't very interested in having people who think and challenge and question and want to decide things for themselves, because they're quite happy to have people spoon-fed with whatever the media is going to get receipts from the government is told to pass on. I just want to round up that. I mean, you mentioned there are 24 countries where this variant from Brazil has already been recognised. How many of those are on the red list from the for travel into the UK?
Oh, off the top of my head, I don't think very many are. I haven't checked, so don't hold me to it. Certainly France and places where it's I mean it's pretty widespread in France, and France is not somewhere that we're blocking. So
you mentioned about the the way that the government is handling the situation here in the UK is a perfect incubator essentially for new variants to emerge here. They're doing exactly the opposite of what they should be doing if they want to try and prevent dangerous variants from emerging from the UK transmission.
Yeah, I think Paul Biernatz, who's one of the world's leading virologists, he wrote a jokey paper saying, if you wanted to create the conditions for the emergence of variants in the laboratory, you would do the following. And it was exactly what we were doing in Britain. And it was basically a dig at the British policy. He said, these are the lab conditions I would set up to create a variant that would escape vaccine. And it was widely shared on social media. And it was him having a dig at what we're doing in Britain. It's not the most sensible way out of a pandemic. That's not to say it's going to fail. It could work, but it's a gamble. We're taking risks that we don't need to take. And it may pay off for the government, but they're kind of stacking the odds against them. Doesn't mean that it's going to fail. It just means that they're taking risks that we didn't have to take.
The UK is doing everything it can to produce a vaccine-proof escape virus. Bonnie, what does that make you feel about the way that the country's being run?
Well, I mean, we've seen examples of where government policy has been so catastrophically wrong time and time again throughout the last year. It starts to look, as I sort of mentioned before, it's starting to look like we're expendable to this government, unless, they're putting their hands in our pockets and making certain people a lot richer, given, I think it's the top 1,000 billionaires have got more money than they can spend probably in 100 lifetimes. Meanwhile, huge numbers of working class people are having to rely on food banks so that they can put food on their table. It starts to look, they're getting it so catastrophically wrong and against scientific advice time and again. It's starting to look like it's deliberate policy. I mean, we've seen confused messaging. You can go out, you can't go out, stay home to protect the NHS, but send your kids to school to sit in the classroom of 30 kids. But no, you can't go and see granny because the rules say that you have to stay outside when you're meeting with strangers. That deliberate confusion of messaging is making it almost impossible for the general public to know what's safe to do and what isn't safe to do. And that's a little bit of blame shifting. It looks like to me, looks like they're going to say, oh, well, people weren't obeying the lockdown, so that's why it's back. It's nothing to do with us sending the kids to school. It's why can't you silly people understand what rules we're giving you? And the rules are not logical at all. They couldn't have been designed to be more confusing.
Like that Matt Lucas Bake-Off skit or whatever it was that he got hammered for from Conservative supporters, I guess. Karen, we're nearly at the end of the show. I'm going to give you the last word on the programme, mate, as you are representing the teachers, the people who are, as much as anyone, on the sharp end of what the government's doing at the moment. So give us a last word on that. And is there anything a word from the teachers, or things that people can do to help out the teachers?
Well, I think the most, like, picking up on some of the stuff that, like, Adam said as well, like, we're not following SAGE. It's quite clear we're not following SAGE, and they're following the lobbyists, isn't it? We can see the influence. We know the meetings are happening. We can see the MP with the CRG MPs really pushing for that Great Barrington Declaration type, let it rip kind of attitude, and that's what schools have become the battleground for. That we're a proxy war for zero COVID versus letting it rip, because they know that schools are the key to the infection. Right at the beginning in March, I can remember when they were selling us herd immunity in the media, it was, we will keep schools, we need to keep schools open to keep a certain level of infection up. Maybe we'll shut and close them to control it, like the gates. Now, for them to be saying that at the start of March, and then from April onwards claim that there's no risk of transmission, it's kind of strange how their thinking flipped so quickly. And it is a matter of getting out those genuine voices. At the moment, it's just, we've got so many of these lobbyists, and we've got so much of the media narrative getting through that really it's about making sure that real voices are heard. So at the moment, like radio phone-ins, like talking on social media, like people need to know that the government's being dishonest. And as much as I can say that, but as an executive of the union, there's always going to be an accusation of bias by what I say in the media or anywhere else. Whereas what we need is genuine grassroots parents speaking up, and teachers and educators speaking up as well. Because at the end of the day, I think they want to portray educators as the enemy. Because once this is all over, their only kind of like vote winning strategy appears to be engaging in a culture war. And that's going to be, once again, education is going to be the battleground for a culture war as well. You can already see it with this language of discipline and some of the ideas that were floating around in the Tory manifesto but didn't get much drag at the time. We've got this anti-decolonising, anti-racism stuff, the religious sexual education guidance that came out a few months ago, the talk when they're getting in the national trusts and talking to them that. So really, it's going to be, I feel that, yeah, we need the lobbyists and the government are going after us, and we need as much support as we can to get those real voices out.
Thank you, mate. Brilliant. Everybody, could you just quickly give a quick shout out if you're on Twitter handle, so we can put it up on the screen and people can follow you if they want to keep up with what you're saying on the issues as they develop.
Yeah, mine's simple, Bonnie Craven.
Karen?
Just Karen Bales.
But it's 2 L's, is that right?
I've got a double, with a double L, due to a mistake when I first created the account that I'm not going to get rid of now.
Don't worry, we'll put it up on the screen so people can see what the right one is. And Adam?
Mine's just Adam Handy.
All in one word, yeah?
Yeah.
Brilliant. Folks, you've been excellent, and I really appreciate your input and your time. Everybody who's watched, and thank you for that. Please share the video, spread the word, and let's try and get people some better information circulating than what they'll get from the evening news repeating the government's PR lines. Thank you, everybody, and we'll see you again on Skwawk Talk next week.
Solidarity, teachers.
Yeah. Thank you. Thanks a lot, Steve.
That's the end of the recording. Everybody happy with that? Any bits you...
Yeah, it's cool. Very good. Again.
Yeah, that's fine.
Good. Yeah, really interesting information. There'll be a few bits I'll pull out as clips as well and promote it. So I'll tag you in when you appear in them.
Brilliant.
All right, everybody.
Adam, it's so helpful to hear your perspective on all of this as well, because, you know, just as a layperson talking about this virus, I don't have access to that sort of detail. So thank you very much for educating us.
Yeah, brilliant. Really appreciate it, fellas.
I mean, it's yeah, we've got an interesting year ahead. I mean, it is an experiment, and it could go. I'm not being disingenuous or just attacking the government for the sake of it. It could go their way. It could work. But what we're seeing so far is concerning, and this is not the way that you would be running a pandemic in ideal circumstances. So, it's going to be pretty rough, I think, for a while, and then we just need to see how winter pans out. I don't think we're going to have a real picture of how things are until November.
Yeah. Wow.
Well, I hope you get some good
what a
news
country
then, because I'm sick of these lockdowns. But the thing is, every time they send the kids back to school, I think, well, that's another 6 months of house arrest. As a clinically vulnerable person, I just view it as another 6 months of house arrest. It's, this is unreal.
Yeah, the thing that bothers me is that they've now said